Do you have pain on the inside of your elbow that's made worse during things like deadlifts, pull-ups, and other grip-intensive activities like picking up a suitcase or a backpack? If you do, then you might be dealing with medial epicondylalgia, which is more commonly known as golfer's elbow. Golfer's elbow is a type of overuse injury that affects the muscles and the tendons attached to the medial epicondyle of the elbow. This includes the pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and the flexor carpi ulnaris. These muscles are primarily responsible for flexing the wrist and the fingers, as well as pronating the forearm. If you're dealing with a case of golfer's elbow that you're trying to fix, there are two main things that you want to focus on. The first is building up the local strength, endurance, and load tolerance of the muscles on the inner portion of the elbow and forearm. And the second is addressing the strength and endurance of some of the muscles of the shoulder. Now we're going to cover 4 of our favorite exercises that we use to help our patients who are dealing with cases of golfer's elbow. The first exercise is loaded wrist flexion. This exercise directly loads the wrist and finger flexors and is arguably the most important exercise when dealing with golfer's elbow. You can perform this exercise one of 2 main ways. The first is a wrist curl behind the back using a barbell, and the second is a seated wrist curl in which your forearm is supported on a surface such as a table and your hand is hanging off the edge. In either variation, you're going to slowly lift your hand up towards the ceiling and then back down towards the starting position using a 2 to 3 second count on the way up and on the way down. If this exercise significantly increases your elbow pain, then you can switch to an isometric wrist flexion exercise instead. To perform the isometric variation, you're going to be sitting with your wrist supported and your wrist held in a neutral position. From here, you're going to use your opposite hand to try and press your hand down towards the floor, where you're going to resist this motion for a duration of 30 to 45 seconds, using an intensity that allows you to work those muscles without significantly increasing any pain. On the other hand, you can also progress the loaded wrist flexion exercise by incorporating wrist and finger movement at the same time. The second exercise is loaded wrist pronation, which primarily targets the pronator teres. To perform this exercise, you're going to hold something such as a PVC pipe, dowel, or broomstick in your hand with your forearm supported. From here, slowly lower the top of the object towards the floor, away from the midline of the body, before returning to the starting position. To make this harder, you can hold the PVC pipe or object closer towards the bottom, and to make it easier, you can hold the object closer towards the middle. If this exercise eventually becomes too easy with the PVC pipe or dowel that you're using, you can progress to a loaded kettlebell variation instead. The third and fourth exercises are exercises that don't directly train the wrist flexors and the forearm pronators, but rather the muscles of the shoulder complex. We are including these types of exercises because there is research showing that people who are dealing with golfers and tennis elbow often have weakness in specific motions of the shoulder, such as abduction and external rotation. However, it's important to note that this evidence does come from research that is cross-sectional in nature, which means that we can't take that evidence and state that weakness of the shoulder is necessarily going to cause golfers or tennis elbow. Despite this, it is still a good idea to include exercises for these muscle groups, as you will indirectly train your grip at the same time, and this will develop a more comprehensive overall treatment strategy. The first shoulder exercise that we're going to do is the lateral raise, which will primarily target shoulder abduction. Stand upright with a dumbbell or other object held in your hand and slowly lower your hand out to the side up to about shoulder height before returning to the starting position. If this exercise really flares up your elbow pain, then you can modify it by doing it in a thumbs up position or using a wrist cuff on a cable system instead. These options will reduce the grip demands and therefore make the exercise much more tolerable on the elbow itself. And the last exercise is a face pull with external rotation. We really like this exercise because it directly targets shoulder external rotation while also having a good training effect on some of the upper back muscles at the same time. To perform this exercise, you're going to set up with a band or a cable system so that the anchor point is roughly at shoulder height. From here, you're going to pull the band or the cable system back towards you and externally rotate the shoulders at the same time, ending with your hands roughly at forehead level. If gripping the bands or the cable system causes an increase in your elbow pain, then you can take your grip out of the equation by simply wrapping the bands around your wrists or using wrist cuffs for the cable system variation. In general, you want to perform 3 sets of 8 to 15 reps for each of these exercises, using loads that are challenging but that don't significantly increase your elbow pain. In most cases, it is perfectly fine to have some level of elbow pain or discomfort during these exercises, as long as we follow some general guidelines. In general, you should aim to keep your pain during these exercises to about a 3 out of 10 or less, and you should use loads that don't cause a flare-up in your pain that lasts for more than 24 to 48 hours. If you found this video to be helpful, please hit that like button, leave any questions that you might have in the comments below so that we can answer them, and make sure to subscribe to our channel for more future injury and training content just like this.